The NCLEX tests a mountain of content, and standing at the foothills of this challenge, it is not uncommon for students to feel completely overwhelmed. From safety protocols, pharmacology, and emergency procedures to pediatrics, geriatrics, and all ages of patients in between, there is just so much crucial information to remember. The question is, how can you remember what you study for the NCLEX? What's the best way to study so that you arrive at the exam 100% ready and confident? Well, here to answer that question is Bradley Bass, a registered nurse and the brain and personality behind the YouTube channel Nurse Bass. He knows all about the challenges of preparing to take on this important licensing exam. So without further ado, here's what he has to say about remembering what you study for the NCLEX and beyond. Okay, so can you please walk us through the problem so many nursing students face, which is getting to the end of nursing school or their review course and realizing that they've forgotten a lot of what they've studied?
Yes, that's definitely a common theme throughout nursing school. I sort of think that it's multifaceted. I believe that one of the reasons why is because you're inundated with information whenever you're in nursing school. What you're really doing is you're making a transition from prerequisite style studies over into a nursing program, which is vastly different. And it's one that not a lot of people are prepared for. Whenever I was doing my prerequisites, I was doing anatomy and physiology and microbiology, and I was taking these courses in conjunction with one another. And I was doing extremely well, excelling like 98, 99 scores on my tests. And whenever I transitioned over into nursing school, my first exam, I did okay. I probably got a high B, and I was thinking to myself, okay, I'm doing good. This is no problem. And I've told this story before, but on my subsequent exam, my second exam, I bombed it. I made a failing grade, and I came from making 98s and 99s. And I think one of the reasons was not only are you absolutely inundated with information, and there's so many tasks and things that you have to do, clinicals, they stretch you so thin. But one of the other reasons is because there's a big transitionary period from going from prereq style questions over to nursing school, specifically select all that apply questions. There's kind of a common theme that gets mentioned, and it's all of the answer choices on nursing school questions are right. You just have to choose the most correct answer. And so it's a massive acclimating process. And whenever you're in prerequisites, you're really just studying for the intention of memorizing information so that you can get a good score on an exam. But whenever you go into nursing school, it's a transition of studying for the retention of information, because this is stuff you're carrying forward with you in your career. It's not just applicable to this semester.
Right. Yeah. And you've got to think, use critical reasoning. I mean, that's new, from the college mode of just trying to retain information to now actually using it, but in a clever, crafty, and skillful way.
Absolutely.
Change your pace, yeah. Well, here at Brainscape, we're huge proponents of spaced repetition as a super efficient method for learning and remembering large amounts of knowledge. What methods do you recommend students use to really drill nursing content into their heads?
Sure. Yeah. So for me, my own personal process, that's kind of all that I can really speak from. And I try my best to reach students before they get to nursing school, specifically when they're doing anatomy and physiology. I feel that's so important and crucial from a foundation perspective whenever you get into your nursing studies. So whenever I was approaching nursing school topics, let's say it's a pathophysiological disease process, whatever it might be, heart failure or something like that, I would start from that foundational point of what is the anatomy of the heart? And as long as I knew that, then I would have a good foundation to move into the physiology. How does a heart function in a normal homeostatic environment in a healthy individual? And once I have that good basis, then I could understand, well, what is occurring when things go wrong? And so then at that point, I could dive into the pathophysiology. Let's say what's going on with heart failure, dilated cardiomyopathy, whatever kind of heart failure it is, I would have a much better grasp because I studied the A&P thoroughly first. But then to actually dive into what techniques that I use, I would really study one section first. So whether I was going from my PowerPoint studies or if I was going from the notes that I took in class, I would study one section until I knew it extremely thoroughly. I would study it until I could teach it to my wall. That's something I did all the time. I would teach it to my wall. If I could say it out loud and regurgitate it and know it, then I know that I was okay to move on to the next topic. And I would not move on until I knew that first bit of information, if that kind of makes sense.
No, absolutely. That having that powerful foundation, I mean, absolutely makes sense. And
Yeah.
teaching method you mentioned is a thing called the
Hmm.
Feynman technique. You know, Richard
Hmm.
Feynman, that famous physicist, told his students, if you can't teach what you're learning and help a fourth grader understand it, then you don't know it well enough. And so,
I love that. I've never
yeah,
heard of that. I don't like the actual individual who coined it. Yeah, that's
yeah,
funny. I've
that's
been
the
doing this
thing.
whole time and never knew.
All right. So for students who are still in nursing school and who are perhaps a year or two out from having to take the NCLEX, what can they do today and every day to prepare for this final assessment?
Yeah. So, like I said, this does kind of harken back to your first question. The fact that you're being given so much information, it's hard to grasp what's crucial and going to be important 2 years from now, whenever I have to take this big test. Um, I think that constant reflection over previously learned material so that you do your best to not lose that information. And then practice tests, practice tests. I know people say it all the time, but what are you doing? You're going to be taking an exam, the biggest exam of your life. And so what better way to prepare for any given craft than to repeat that craft over and over and over. So I think as you're preparing, maybe you are a year out, so you've still got a while to go and you're still getting hit in the face with all of this information and stuff that you still have to do now. But in the midst of all that, trying to make time to reflect upon previously learned material, as well as just getting as many reps under your belt as you can with
Right.
these
And
practice exams.
yeah, absolutely. And if you can see what the NCLEX looks like early on, as you're
Mm.
progressing through learning this material, you actually learn how the exam works, and you can start recognizing in the content, wow, this is a question I could potentially get asked, or starting to view the content through the eyes of the examiner, which is a really clever way of preparing early on.
Yeah, I actually think that's a really, really great point. Yeah, that's something that I actually didn't pick up on until the end of my final semester. I'm glad you brought that up. Actually dissecting it from the perspective of the exam preparer, so to
Yeah.
speak, and breaking down a question, not just knowledge based, like, okay, I need to know this, that, and the third, but also why are they constructing, like breaking down a question, why are they constructing it in this way? What are the key takeaways? What are they getting at with this question? And I think the more and more that you approach those practice questions and practice tests from that perspective, like you said, I think the better prepared you'll be.
Yeah, it's one of the main points of advice we give to all students, even people taking the bar exam, is to take a practice exam really early on in your review course or even in school, so that you know what to expect and, can prepare you to take on that final.
Absolutely.
Yeah. Cool. So what other important study tips do you have for students preparing for the NCLEX?
Goodness. Yeah. So one of the things that I say, I've pretty much given the tips. I know that I really didn't give much, but one of the things that I say is that, a lot of folks struggle. I mean, that's why we're doing what we're doing, right? A lot of folks really struggle with this information. And I often say that unfortunately, there really is no secret sauce or golden nuggets that I can really give. Ultimately, you try and figure out how you learn the best, what works best for you, and then do it and do it and do it. And so one of the things that I always say that resonates with folk is one day patient lives will be in your hands.
Yeah.
So study like it.
Right.
And then as you're doing your preparation and doing everything that you need to do, ask yourself, constantly audit yourself. Am I studying like it?
Yeah.
Understanding that this isn't just to pass an NCLEX, a national exam. One day these lives are going to be in your hands. We're in the human life business. We're here to care for individuals. And so are you doing what's required to meet that bar? And almost always the answer is going to be no. So that's kind of an internal drive and motivator, at least for me, to push a little bit harder, dive a little bit deeper.
Yeah, you made my hair stand up a little bit when you said that.
Lord have mercy.
So cool. It's terrifying,
Yes,
but really rad at the same time.
Sure, yeah.
All right, so let's change tack and talk about retaining nursing knowledge after nursing school and the NCLEX. So I imagine that, an aspect of this knowledge base isn't being used regularly in the clinical environment. Nurses might actually forget things. So what are your best practices for maintaining a working knowledge of nursing content in the years after nursing school?
Yeah. So I've found for me personally that one of the best ways is actually working. I've said it before, but I've learned far more in my career than I ever did in school. School really was a foundational preparation for what this career was going to provide. So not only is it just experience gained, getting reps under your belt every day, getting shifts under your belt and caring for sick individuals. I work in a cardiac ICU. I know many folk out there have many different aspirations within the field, but not only that, And in addition to that, most employers require continuing education. So it's not something you have a choice in that regard. And so in that manner, you also are going to get continuing education to continue to retain this information. But then I really recommend also to understand, okay, I did all the proper studying in nursing school. I did everything I needed to do to pass the NCLEX with flying colors, and I got that job, and everything's great. And I studied adequately to care for human lives. But then to also understand that it is a tool that needs to continually be sharpened. So not only are you doing continuing ed, not only are you getting shifts under your belt, but taking time to yourself. Anything that you're realizing during your shift, because none of us are perfect, anything you realize during your shifts that you're deficient in, those vasoactive medications, that sedation medication. I don't quite understand what dexmedetomidine does. Diving into that, learning more on your own as you're noticing deficiencies, correcting those deficiencies. That's kind of my own personal.
Yeah, no, that's great advice. And also I spoke to another nurse who said, never be afraid to ask questions if you don't understand something in the clinic.
100%.
Yeah, don't be afraid.
Yeah, that's actually a common theme. That's a good thing to bring up also, at least in critical care where I work. If somebody is going through their shifts and not asking questions, it's almost kind of a concern. Even folk who have been there doing it for a decade or two, everything is always changing and every patient is different. So yeah, continually asking questions, the inquisitive mind.
Yeah,
absolutely.
Yeah. All right. So finally, can you tell me how your YouTube channel, Nurse Bass, can help students be successful in their studies and their careers?
Oh, Lord. Yeah, so, I mean, I've been told that I'm an all right educator. So maybe you would go to my YouTube channel to receive educational information that would maybe help you in your path. But primarily, I think what I do is I provide a perspective of somebody who I'm just like you. I'm no different. I'm just a guy. I'm just a guy who decided to press record before I started my nursing school journey, and I just continue to do so. So I think what I really try to do is provide an injection of perspective and motivation that I'm just like you. You may look at me as whatever, but if I can do it, you can do it. Like in the truest sense, if you knew where I came from, it is possible, you can do it. And that's really what I try and do. I try and provide that motivation to people because again, everybody's struggling. It's so difficult. So many people quit. There's so much burnout, but it's possible. And I know that you can do it. And that's kind of what I try to provide.
Amen to that.
Absolutely.
All right. Well, thank you so much for speaking to me today. I really appreciate all the great advice you've provided. And I think
of course,
our viewers will agree.
I appreciate you.
Well, there you have it, the best advice on how to remember what you've studied for the NCLEX and beyond from registered nurse Bradley Bass. For more awesome nursing school advice, educational videos, and motivational content, check out the YouTube channel Nurse Bass. Now remember, don't make the mistake of progressing through your course material in a linear fashion, starting at the beginning and ending at the end, and never stopping to review the content you've covered in the days or weeks before. If you don't make time for consistent review, you will only forget what you've studied. And this is a really important tip for doing well on the NCLEX. If you are studying to become a registered nurse or nurse practitioner, make sure you get Brainscape's NCLEX or nursing flashcards, which will help you study so much more efficiently and keep up that healthy cadence of daily review that is so essential for doing well in these content-heavy subjects. For even more guidance, check out the other videos we have on Brainscape's nursing channel and go to the Academy for A to Z study guides on how to excel in nursing school and beyond. These tools, together with your ambition and hard work, is everything you need to rise to your challenge.